Hello. I'd like to go ahead and welcome all of our participants and thank you all for joining us today. So my name is Sarah Ishag and I will be one of the moderators along with our CEO of Wall Street Research, Alan Stone. As many of you may already be familiar with Wall Street Research is a 40-year-old research and investor relations and consulting firm. We've been running these roadshows for quite some time nationally and recently transitioned due to the current climate. So today we are presenting our client company, Zhittya Genesis Medicine Incorporated. Zhittya is a private company which is developing biopharmaceuticals to treat the cause of death and suffering for over 50% of all adults worldwide. And they're currently advancing a group of drugs which trigger the human body's natural regeneration process. So we're going to have the president, Chief Science Officer, and Chief Science Officer Dr. Jack Jacobs present, along with the CEO, Dan Montano. Following the presentation, Alan is going to present a series of questions prior to opening up the Q&A session. So to all of our participants, if you do have any questions, please feel free to add those into the chat box, and we will attempt to get through as many as possible prior to the end of this call. Also, I'd like to just mention a brief, quick disclaimer. This is a private offering that's open to accredited investors only. So most of our participants should fall into that category. However, if you are not considered an accredited investor, we do ask if you can kindly exit the room. So your continued participation is an affirmation that you are. Also, we will be sending up follow-up emails directly following the webinar for those of you who may have serious inquiries regarding the offering. So you may be in touch with the team. And with that being said, I'll go ahead and pass it over to Alan Stone so we can get started.
Yeah, thanks, Sarah, and welcome everybody. I'd like to thank all of our participants for joining, and also like to thank the company, Zhittya Genesis Medicine, Inc., for hosting this webinar with us. As many of you know, we run roadshows all around the country, principally in California, New York City, Florida, and also in Las Vegas. And starting a few months ago, about 3 months ago, we began to do these meetings virtually because of the COVID. And so we've run quite a few of them in the last several months, and we're very pleased that Zhittya Genesis Medicine contacted us. We had met the company actually at a presentation that they gave about a year ago in Las Vegas, and I had met the Chief Scientific Officer, Jack Jacobs, a year ago, as well as Dan Montano, the CEO. Was very impressed with what they had, and we stayed in touch, and we're pleased that they were able to come into the program today. And they've got a very extensive array of different critical healthcare ailments that they're really focusing on that affect many, many people and the older populations. So you'll learn more about that today. And as all of you know, Wall Street Research is also in the research business. We publish and distribute research on a global basis. We're ranked #1 on Google, Yahoo, and Bing. We're in the process of writing a report right now that should be out early next week. Our website is wallstreetresearch.org. I'd encourage all of you to go to the homepage, wallstreetresearch.org, and put your email in there, and that way you'll get the reports as they're published automatically. And so with that, I think I'd like to start the presentation and welcome Dr. Jack Jacobs to do the PowerPoint, and then he'll be followed by Dan Montano, the CEO.
Okay, thank you, Alan. Let me just share my screen. Okay, hopefully you all can see that. can therapeutic angiogenesis extend your life an additional 30 quality years? So how are we going to do that? Well, talk's divided into two parts. The first, I'm going to talk about how we're using our therapeutic regenerative medicine to actually reverse diseases that affect and kill more than 50% of all people, adults in the world. So first, we're going to reverse these diseases, but also our drug can also revitalize our circulatory system by repairing our blood vessels. As we get older, we know our blood vessels deteriorate. And at the end of the talk, I'll show you how this drug can also repair blood vessels. Now, we use the word angiogenesis. And angiogenesis is simply the growth of new blood vessels in our bodies. We do it when we're being formed, and we do it all the time as we need to. We have over 60,000 miles of these blood vessels in our bodies, enough to wrap around the world almost 3 times. And we know if we get blockages, let's say in the heart, you can suffer coronary artery disease, blockages in vessels going to the brain, stroke, but also be talking about newer diseases where researchers have shown that a lack of blood flow can initiate Parkinson's disease, Alzheimer's, and other neurodegenerative diseases. In fact, there are over 75 human diseases that result from a lack of blood flow to an organ or tissue. We're actually working on 19 of these medical indications, and I'll talk about a few of those today. But first, let me just introduce this concept of angiogenesis, the growing of new blood vessels. We use our drug all the time. If you fall and cut yourself, scrape your elbow, as a skateboarder's done, he's going to use, he's going to use angiogenesis to heal that cut. So here it is. This is natural angiogenesis. Let's say this is the scrape on that skateboarder's arm. This is like a scab on his arm, let's say. We're looking underneath there, and here you can see this whole array of new blood vessels being formed. This is what our drug stimulates. It's probably the most potent stimulator in our bodies of this new blood vessel growth. And what that does, it regenerates in this skateboarder's elbow. His entire skin is an organ, just not the skin cells, sweat glands, hair follicles, nerves, everything you need to regenerate skin. So we're going to be using that drug from our bodies to treat a number of diseases. Here it is. This is the name of the drug, FGF1. It's a natural growth factor in our bodies. I actually purified this. It's most abundant in our brains. I purified it as a graduate student a number of years ago. I was at Washington University in St. Louis, and we actually purified this from cow brains. Again, this is a very potent stimulator of new blood vessel growth, or angiogenesis. So let's go back, think about that skateboarder's cut. When he scraped his elbow, his body made, here's FGF1, migrating to that wound site. And here's the FGF receptors. So this is a key interaction. This is the growth factor, kind of like a key fitting into this lock of receptor, and that stimulates this whole process of new blood vessel growth. So we get cells within the blood vessel start to divide, they start to grow, migrate. And here we see right here the formation of a brand new blood vessel, which is going to help heal that scrape. And this is repeated thousands of times along this vessel. One important aspect of our drug is that only when you have damaged tissues, ischemic tissues, do you get a tremendous upregulation of these receptors for our drug. So the drug actually concentrates in the body where it's needed. And this is shown, we've seen this in a number of different animal models. Let me talk about 3 examples of us using this drug, FGF1, to treat diseases in people that result from a lack of blood flow. We'll start at the bottom of the body. We're going to look at diabetic foot ulcers. We'll then talk about coronary artery disease, and then we'll talk about Parkinson's disease. Again, all these diseases, coronary artery disease kills almost 25% of all adults in the world. Okay, a frequent complication of diabetes. 25 million Americans have diabetes. 5 to 7% of those patients every year will develop this nasty foot ulcer called a diabetic foot ulcer. These are chronic wounds. They can't close on their own. They can get infected, which can lead to gangrene, and the most dreaded complication of the diabetic foot ulcer is a lower leg amputation. Once that occurs, a person has about a 2-year life expectancy. So we can put FGF1 directly into the wound, directly into the ulcer, and I want to show you some results from a phase 2, US FDA phase 2 clinical trial, where we healed 100% of these chronic foot ulcers. Okay, so this is the fraction of open ulcers. So beginning of the clinical trial, all the ulcers are open. We treat half of those with FGF1 in blue. The red are placebo doses, as is done in phase 2 trials. So we treat over weeks and months. And towards the end of the trial here, after about 130 days, we've closed completely all of the FGF1 treated ulcers. About 30%, 35% of the ones treated with placebo remain open. This is a very big deal. These open ulcers can go on to become infected, so lots of economic costs, suffering for the patients. So this is really a satisfying result, and we're going to continue the clinical development of this product for diabetic foot ulcers. Let me just show you what a treated ulcer looks like. Here's one of those open ulcers on the foot before they get treated, and this is after about 4 months of treatment with our drug. You can see complete closure of that ulcer. Okay, a second indication which we have FDA clinical trial data on is in coronary artery disease. Now here, obviously, we don't put it topically. We have to inject it directly into the heart. So these are patients that have severe coronary artery disease, or basically cardiac cripples. And I'll show you a video where you'll see what our treatment did to these patients. But we inject it directly into areas of the heart where there's blocked coronary arteries. So the heart is ischemic, and we're going to be growing new blood vessels in the hearts of these patients. Now, I know the results of our US trial very well because I supervised this trial. It was done at about 6 different sites, but our University of Cincinnati site got a lot of attention. Patients there were actually interviewed by ABC News. You'll see a news clip, a very short one, where they interview both the treating cardiologist, Dr. Lynn Wagner, and also some of the patients who got treated. Remember, these patients were cardiac cripples going into the trial, and you're going to see what how they were acting 3 months after the treatment. So here's a video clip. I will not talk through it, but you can.
But since receiving an experimental treatment for his blocked arteries, his pain is gone.
I really feel great.
Duke was one of the first heart patients in the country to be treated with a protein actually capable of growing brand new arteries. The genetically engineered protein is injected directly into the heart. Within days, a network of new vessels begins to grow around the blockage, increasing the blood supply. Dr. Lynn Wagner showed us the changes in one patient's heart.
We see a small, narrow main artery and not very many secondary and tertiary arteries. This is after the treatment. What we're now seeing is new blood vessels growing here off the end of this artery.
And the patients themselves?
Symptomatically, they're improved within a couple of weeks of the treatment.
Just ask Constance Donnelly.
Oh, I feel wonderful. I've never felt so good in the last 5 years.
But doctors already see potential in other cases where the blood supply needs a boost, such as strokes and diabetes.
So I just want to mention the woman we saw there, Constance Donnelly, came in a wheelchair to this trial. And there she is 3 months later, up and about. So she really responded well to this treatment. Okay, I'd like to move on to the third application, looking at the same drug to reverse Parkinson's disease. Now, Parkinson's disease affects dopamine-producing neurons in the brain, And they're contained in a very tiny area of the brain. So the brain has billions of neurons, also billions of capillaries, but the dopamine cells are right here in this small area. It's kind of dark area called the substantia nigra. Only about 500,000 dopamine cells, and they start to become dysfunctional. Imaging studies have shown blood perfusion begins to decrease. Actually, it's down 50% in these patients. Decrease in blood flow leads to the dysfunction and death of these dopamine neurons. So normal dopamine neurons in healthy people, normal movement. Affected dopamine neurons lead to the characteristic movement disorders in Parkinson's disease, the tremors, the gait disturbances. So we tested our drug in an animal model of Parkinson's. It's actually a primate model, monkey model. This is kind of the gold standard before you go into the clinic. And we can see we can give this guy Parkinson's disease by injecting actually a toxin into his brain, and he comes down with all the classical symptoms of Parkinson's disease. So we're going to treat a group of monkeys with our drug FGF1, and then another group will get a placebo dose, and we can look at their movement scores. Okay, so these are the movement scores. This is normal movement. This is highly abnormal movement in the monkeys. We inject the toxin directly into the brain, and then over a period of months, they come down. At this point, none of them have been treated yet, but at this point, they have all the classical motor symptoms of Parkinson's disease. We then treat half the group with our drug FGF1 intravenously. You can see after about 2 months, the progression in the motor disabilities halts, and they actually get better here. And if we had treated longer, perhaps they would have even recovered more motor function. Where those that receive placebo dose continue to decline, just as is seen in the human form of this disease. Now, importantly, we want to look in the brains of these monkeys to see if we're doing anything to the dopamine neurons. These are the neurons that are being destroyed in Parkinson's disease. And in fact, we are. You can stain for new regenerated dopamine cells with a brown stain. You can see all these brown areas, they're newly regenerated dopamine producing neurons. The animals that got placebo, very little dopamine producing neurons. So we believe we are attacking the root cause of Parkinson's disease in these monkeys. And that's why we're so excited to get into the clinic to try this in people. We've been approved to begin a trial in Mexico. In the US, they liked our clinical protocol as shown here, but we're doing one additional animal toxicity study since this is the first time our drug FGF1 has been looked at a brain indication. Mexico said, no, your animal data is fine, and we're going to be starting going once the pandemic lifts there. We're also being considered in Estonia, which is a Baltic country, and in Morocco. So in the clinical trial, we'll be studying 3 ascending doses of the drug, no placebo group. All patients will get a 1-hour infusion 5 days a week for 4 weeks, administered through a central port or PICC line. And we'll be looking at both the safety of our drug and whether it can be effective in reversing Parkinson's disease. This is a first in human study, so they're called proof of concept studies. But if it's safe in people, we can tweak the amount of drug we give. We can give larger doses. We can give it for longer periods of time until we see efficacy in this patient population. We're actually developing drugs for 19 different medical indications. I talked about heart disease, stroke recovery. PAD affects the legs of individuals, more like atherosclerosis of the leg arteries. All these different wound healing disorders, which can be, will get topical application of the drugs. We have FDA evidence on venous ulcers, bed sores, surgical wounds. Interestingly, when wounds heal with our drug, FGF1, there's less scarring, so we think there's an indication for cosmetic burns. Male pattern baldness, we kind of discovered by chance. If you inject the drug subcutaneously, you get little tufts of hair growing in animals, so that's a potential indication as well. All these brain disorders, this is work not by us, by a growing community of medical researchers, that all these indications initiate and progress due to a lack of blood flow. including Parkinson's, ALS. We've been approved to begin an ALS trial in Mexico, Alzheimer's, chronic depression, MS, traumatic brain injury, PTSD, CTE is what these boxers and football players come down with, vascular dementia. MSA is a kind of nasty form of Parkinson's. If you go to our website, we've written white papers on all these indications. We've also given webinars that can be viewed. So please go to that website. I'd like to close on just some data which shows that our drug also can repair blood vessels in not only in diseases, but in aging. As we age, our blood vessels tend to break down, they become leak, as shown here. And if you look at these vessels, they're suffering from what's called, it's a medical condition called endothelial cell dysfunction. It's inside our capillaries. So here's the inside of a blood vessel. This is capillaries. We have 60,000 miles of these in our body. This is normal lining. These are the normal endothelial cells. But as we get older, and in certain diseases, we develop what's called endothelial cell dysfunction. And these are leaky. These are leaky blood vessels. They leak things out, which can do damage to surrounding tissues. And in the brain, it can do damage to nerves. And it's known, for example, in MS, but also as we age, that our normal healthy blood vessels shown here, giving rise to healthy neurons, can become damaged, as shown here, can become leaky. And things which should never be outside of the blood vessel, immune cells, sticky proteins such as fibrinogen, these all can damage neurons and lead to what researchers now think is why our brains don't perform as well as we age. Remarkably, our drug can restore and heal these damaged endothelial cells. Here shows FGF treatment. This is an animal model of MS where the endothelial cells are damaged, become dysfunctional. You see, as we treat those animals over a 30-day period, here we're back to nice, normal, healthy endothelial cells lining the blood vessels. You can also stain those endothelial cells. Here's a leaky capillary getting healed with FGF1. Here we go, complete healing, tight junctions. This is a restored blood vessel. So we're very interested in looking at this not only in the diseases which cause the death of over 50% of adults in the world, but also in healthy populations as we age. So now our CEO, Dan Montano, will discuss the business aspects of our operations and also the investment opportunities. Thank you for your attention, and we'll take questions, I think, at the end of Dan's talk.
Thank you very much, Jack. I appreciate. Ladies and gentlemen, now I'll be talking about the investment opportunity that we hope to show you. Next slide, please. First of all, I want to make sure you understand this is a pre-IPO information. This is not an offer of an investment. This is a private placement, can only be made to those who are financially qualified. We believe you are, but obviously, before we send you any important data, we have to reconfirm that. Those people who can demonstrate they're financially suitable, we will send the private placement pre-IPO shares and be forwarding you additional information upon the placement request. Next slide, Jack. So Zhittya Genesis Medicine makes drugs, like Coca-Cola makes the syrup for Coca-Cola. And there are a series of regional marketing companies that are in partnership with us that will take the drugs and sell them. When they do that, we split the profits. So if the marketing company sells a drug and it's a topical drug like diabetic foot ulcers, after the cost of doing business, what is left is the operating profit, and we split that 50-50. If it's an injection or infusion drug, like the heart, then the profit split is 75 for Zhittya, 25% for them. The largest market is the United States and Canada, and our partner company there is called Wound Healing Biopharmaceutical. Second largest market is Europe. That is called the Regenerative Medicine of Europe. The third largest market is the Middle East, North Africa, and the fourth largest market is Latin America. And in Latin America, that would include Mexico, where we're now conducting trials, and we anticipate that we can get approvals in Mexico for some of our indications, as an example, to treat Parkinson's. Right now, we're talking about each of these marketing companies will go public. Each of these marketing companies will go public through a US S1 registration. The same highly respected securities firm will do each company's IPO, and they are targeted to list on the New York Stock Exchange. So the one we're going to talk about today that is not completed its pre-IPO is Regenerative Medicine of Latin America. Jack? Regenerative Medicine of Latin America is targeted to do an IPO of 1 million shares at $10. Now, I want to clarify something. A pre-IPO doesn't mean a company's private and someday plans to go public. A pre-IPO means you have a commitment from a securities firm to do the IPO. So we have a commitment from a highly successful 25-year-old securities firm to conduct this IPO for Regenerative Medicine of Latin America. They have done over $50 billion worth of IPOs over the last 25 years. They have an excellent track record for IPOs. This year, they did 3 IPOs for biotech companies and the average of about $250 million each. So obviously doing one for us for 10 million is tiny. And afterwards, those shares will list on the New York Stock Exchange. Next slide, please. So the pre-IPO placement for Regenerative Medicine of Latin America, I'm going to go through the capital structure because the reason it was structured this way is to give the investors an advantage. And we believe the marketing companies are low risk, high reward. And the capitalization is part of that secret. So the founding shareholders of this company have 1 million shares. The pre-IPO investors, the people we're talking to you right now about participating in, will be 1.5 million shares at $2 a share. The total outstanding prior to the IPO will be 2.5 million shares. When the company does the IPO of 1 million shares at $10, there will then be outstanding 3,500,000 shares. And at $10, that's a market cap of $35 million. Now, I want to compare that to 2 things. The Wall Street Journal wrote up, and obviously we'll send you all of this information to verify everything we say is accurate. The Wall Street Journal did a write-up saying the average biotech has a market cap of 535 million without any drugs approved and without any human data. Now, in our case, we have human data on 3 indications. We have huge marketplaces, and we are close to being able to seek approval. But the average is 535 million. If you compare the IPO market capitalization at the end of the completion at $10 a share of 35 million, I think we can all agree that 35 million is less than 535 million. Now, the second thing is a company called Acadia Pharmaceutical. Acadia is based in San Diego, California. They make a very powerful tranquilizer that supposedly deals with the hallucinations of people in late-stage Parkinson's. You've probably seen their TV commercials. There's an older gentleman and he sees his dog fade in and out. And the name of the product is Nuplazid, I believe. And that product doesn't work very well. In fact, I think it's a disaster. But before their drug was approved, that company had a market cap of 3.8 billion. Now, for those of you, if you look at the after market cap of the IPO of 35 million, I think you can see that 3.8 billion is substantially larger, over 100 times higher. I believe that the IPO at $10 will be a bargain. So obviously, I think the pre-IPO at $2 is a bargain. The opportunity is for pre-IPO placement shares at $2 each. We've already placed 300,000, so we still have 1,200,000 shares to go. I anticipate that this placement will be done probably in the next month or so, completed. And I believe the IPO will take place sometime next summer, about 6 months after the completion. Next slide, Jack. Positive investment justification. We believe that 16 of the 19 drugs that Zhittya is advancing address an unmet medical need. Now that's a technical phrase that the FDA has, unmet medical need, meaning there is no other satisfactory therapy. Parkinson's disease, stroke recovery. There's nothing that's being done for these. Alzheimer's. We believe that because of that, the FDA will give us preferred treatment, which I'll come to in a moment. We also believe that our disease, or our drugs, are disease modifying agents. We don't address the symptoms of hallucination. We address the root cause of the disease, therefore we modify the disease. We can't use the word cure, but in monkeys, we almost cured them of Parkinson's. Now, our drugs have a high probability of obtaining the US FDA breakthrough designation. The US FDA says that if a drug addresses an unmet medical need, and there is a need for it, that they will grant this special designation called breakthrough therapy, which means you get faster review, you can be approved after phase 2, all kinds of wonderful things as far as the operations. But when it comes to the stock market, we'll talk about that in a moment. And equally so, there are big opportunities. So for Latin America, we believe the marketplace for the diabetic foot ulcer drug alone is $2 to $6 billion a year. Venous ulcers, 2 to 6 billion. The heart, 30 to 60 billion. Peripheral artery disease, 10 to 15 billion. Brain, 400 million to 40 billion. But let me come back to the heart for one moment. There are 600 million people in Latin America, almost twice the population of the United States. We believe that 20 million people there need our molecule in their heart. And we're talking about treating 1 million a year. So it's a huge opportunity. Next slide, Jack. This now addresses the additional justification. Each medical indication should have a monopoly. It's called a marketplace exclusivity for the US and Europe, and therefore the rest of the world, in my opinion, where we cannot have any competitors for 10 or 12 years, depending on which location. Additionally, as a company, we have targeted that our medicine, the therapy, will come in at 20% of the comparable cost today for the standard of care. So if the standard of care for something is $10,000, we're going to offer an alternative at $2,000, which is better healthcare, curing the diseases, and we think that we're going to get a lot of acceptance from the people who pay for it, insurance companies, pension funds, retirement funds. The marketing company, Latin America, gets all the sizzle. Now, they have Mexico. So if we are able in Mexico to demonstrate the molecule is safe in the brain, and we're able to show that the people with Parkinson's are able to improve their situation, all that sizzle will go to Latin America. And we also believe that there's a high affinity and public support for all these diseases we're addressing. Of the people who have diabetes, they know how deadly a diabetic foot ulcer is. We can treat those. For the people who have Parkinson's, they want us to succeed. Next slide, please. I want to talk real quick about the FDA breakthrough therapy from a stock market point of view, an investment point of view. Jack? So case study number 1, Accredited Pharmaceutical. This company, once again, this is their drug. They treat hallucinations, late-stage Parkinson's. The clinical trials basically said water did the same for patients as the drug did. As far as side effects, twice as many people died with the drug as water. But the FDA approved it because of pressure from Parkinson's sufferers. Give us something, like for Alzheimer's, give us something. After they received the breakthrough designation, but before their drug was approved, they had a stock market value of $3.8 billion. Once again, that's zero revenues, zero data that supports it, 3.8 billion. Next one, Jack. This is a company called Intercept Pharmaceuticals. On January 2015, they had no FDA approved drugs. On January 30th, their share price that morning opened at $167 a share. The only thing that happened that day between the opening and the close of the stock market was the Intercept announced that they had received the US FDA breakthrough designation. The stock closed that day at $201 a share. The market capitalization increased in that one day, $660 million to a total value of $4.3 billion. Now, I want to emphasize, we have 16 shots at getting a breakthrough designation. I believe in the drugs in our portfolio. Next slide, Jack. So if you want to participate in clinical trials, please go to our website, zgm.care. You can download papers, you can see medical presentations. If you want to learn more about the investment, please email me at my personal email address, dan333@aol.com. Now I thank you, and we turn it back to Alan for questions.
Thank you very much, Jack and Dan. Really excellent presentation. And I really enjoyed the not only the medical aspect of it, but the business aspect. It's very compelling.
Thank you.
Story.
The screen back, okay?
Yeah.
Okay.
Okay, great. So, so I have a series of about 10 questions for first you, Jack, and then for Dan, and then Sarah will have then take questions from the chat room. So first of all, when was the company started, and how long have you been doing drug discovery in these areas?
Well, we've been doing drug discovery in this area for about 20 years. Zhittya's been around for about 6, and we're really pretty much done all the preclinical work except for the US FDA wanted to do that one additional animal study for our Parkinson's trial. So we're really ready to get into the clinic. We're going to be doing that in Mexico, in the United States, in Europe. So we're going to be completely driven, clinical trial driven company at this point in time.
Oh, that's great. And how many diseases are you focusing on overall? I know there's like 3 big ones that you mentioned: Parkinson, coronary artery disease, and diabetic foot ulcers. How many different
Right, so
together?
One of my slides I mentioned there's 75 human diseases. We're going to focus on 19 of them. Obviously, we can't do them all at the same time, but we are starting with Parkinson's. We'll go on with the heart and also with the diabetic foot ulcer trials. And also we have ALS.
Where are you?
Another
Oh, great.
is going to be starting in Mexico as well.
Very good. Where are you in the pipeline in terms of clinical trials with your lead drugs?
Right. So with all the brain disorders, we're really doing these proof of concept trials. We have animal data that it works in animal models, but we have to take it into the humans for the very first time. So they're phase 1. But as I showed you, the diabetic foot ulcers, the heart have already been in FDA authorized trials. So we'll try to jumpstart those clinical trials maybe a little bit further along in the developmental cycle, say perhaps at phase 2.
Excellent. And are there any hospitals or universities that you have special affiliations with that are worth noting?
Yeah, I think for each medical indication, for example, the diabetic foot ulcers, we visited the New York College of Podiatry, had a nice visit there. They're going to participate in the trial. Houston Foot and Ankle Clinic, sites in Miami. For the Mexico trials, we visited Monterrey. They have a very brand new hospital there, very well equipped, great neurologist. So we have contacts, throughout the world basically to do our clinical trials, and we'll pick sites that we think can do this rapidly. Hungry principal investigators that aren't going to be doing 25 different things are going to really be interested in our trial. So that's kind of our philosophy in picking sites for these studies.
Well, that's fantastic. Can you tell us a little bit more about your scientific and medical advisory team and any advisory board members? Yeah,
so for any medical indication, we pick advisors. So for Parkinson's, we have a nice, well-known neurologist here in Vegas, 2 neurologists in Monterrey. For the diabetic foot ulcers, we have internationally known podiatrists who treat these. For the heart, we've worked with cardiologists in the past. So we'll pick, again, hardworking people who are going to dedicate themselves to our efforts to move this along as fast as possible.
Then where do you get your IP and technology from? Is this is this information that you've developed on your own over time, or do you in-license some of the
Well,
IP?
as Dan Montano mentioned, we enjoy what's called marketplace exclusivity. These are laws in the US and Europe that protect us. Once we bring FGF1 to market, say for the heart indication, we have 10 full years of protection. Nobody else can develop it for that indication. So that, in our mind, is actually better than a patent. So we will not be in-licensing really any technologies. We're going to use the marketplace protections that are already in place to give us marketplace exclusivity.
And then are there any relationships that you've started to reach out to or develop with big pharma or major pharmaceutical companies to kind of help subsidize some of the costs of the clinical trial work?
We're a little bit outside the box concerning big pharma. I think once we see some evidence in the brain, at least, I think they'll maybe take more notice. But we want to do this on our own. We are very passionate about this. Dan is raising enough money for us to do this alone, and we don't particularly want big pharma at this point, but Dan can also chime in on that.
Yeah. So that leads me to Dan. How much capital has the company raised to date for your various drug discovery and research and development efforts?
Well, Alan, in total, we've expended $140 million. Now, some of that has been capital for the company. Some of that has been partnerships. Some of that has been clinical development partnerships. So we have many unique ways to bring money into the operation. And so as an example, we've used a clinical development partnership to fund the diabetic foot ulcer trial. So it's not capital into as far as capitalization, but it is money into it. In exchange, we pay a royalty to those people. So $140 million is what Jack has spent so far, and I've raised so far. Jack spends, I get the money. It's kind of like my relationship with my wife.
Yeah, it sounds that way. So, you mentioned, that the offering that you're currently doing is the private placement, the pre-IPO offering. And I believe that's at $2 per share. And I think you mentioned that there's 1 million shares, and this is for one of the, as I believe, the Latin America company. And I believe you have 1 million shares that are owned by the founders, and then 1.5 million being offered. So and that's a 2. Can you just shed a little more information about that private placement?
Yes, and Alan, I noticed one lady, Barbara, had a question, why are we starting with Latin America? And I need to clarify that too, okay? The first company to go public is going to be the United States company, Wound Biopharmaceutical. Its registration statement is ready to go to the SEC. The underwriter's commitment's in place, everything is done. The road shows will be starting as soon as we hear back from the SEC, and it's my guess that company will go public in December, January, and I will be shocked at $10 a share if it's not oversubscribed many, many times. Following that, the Regenerative Medicine of Europe pre-IPO placement has been completed. The management of that company is preparing the registration statement to file with the SEC, I hope in the next 60 days. So that company can go public probably in February. After that, the next company to go public in order will be the Middle East, North Africa. And part of the reason for that is I was an investment banker from 1968 to 1998. I lived in London for 5 years with my own securities firm. I've raised billions of dollars out of the Middle East, North Africa. I know the area extremely well. I know a lot of very wealthy people and institutions, and they have all these diseases. Regenerative Medicine of Latin America will be the 4th one in the train. So the front of the train, the engine is the US market, 2nd is Europe, 3rd is Middle East, and Latin America will be the last or the 4th one. Now the reason, in answer to your question, the 1.5 million share pre-IPO placement. We're out. We just started. We just finished the Middle East one last week. We just topped that off. And so now we got $490,000 for Latin America done in 1 week. So we're just starting up now. This is actually our first presentation on Latin America. And that, once again, will follow the train. So I believe the first one's IPO will be hot. I believe the second one's IPO will be hot. I believe the third IPO will be hot. And I believe Latin America will benefit from the success of the prior ones. So this private placement at $2 a share, it's the same securities firm. Obviously, the biotech deals they did were, one was 300 million, one was 240 million, one was 180 million. The only reason they're doing these tiny IPOs for biotech, 1 million shares at $10 for biotech is not even real money. But we don't need the money. What we need is the stocks to go up and get us attention so that people will know what we're doing. Because people who have heart disease need to know we can save their lives. You saw the ABC news clip. How come nobody knows about it? We have to get out and tell our story now, because we're getting to the point where if the people suffering from Parkinson's got Acadia's medicine approved, we want them to know about ours, because we can treat their disease, not treat the symptoms as they continue to spiral downward. So Latin America is the one we're working on now. And after that, we'll do Southeast Asia. After that, we're going to do China. And after that, we're going to do India. So if you miss the first, if you miss them, just keep watching. We'll come along with another one soon.
Wow. So it sounds like you're going to be on the road for the next year, probably.
Well, Alan, we were scheduled to be in the Middle East in March, April. We had a speaking engagement in Jeddah with 400 doctors on critical leg ischemia. We had meetings in Riyadh, Saudi Arabia. We had meetings in Kuwait with doctors who are shareholders already. We had meetings in Qatar with doctors. We work, you know that. You've known me for a long time. We know how to do a roadshow. And the good news is that someday this COVID-19 is going to diminish and we'll be able to go out and work again.
That's fantastic. And so I think you mentioned that the first IPO for the U.S. company, then it's going to be, did you say January for that one?
Our target, well, it's going to be somewhere between the middle of December and the 1st of January. But once again, you know, the marketing companies have no expenses. I mean, anybody in the world understands that if a marketing company for the United States, there's no product to sell. Now, they have our sizzle to sell. They have the world to tell them what they have. But they're low cost. So if we defer it till January because we think the market will be hotter, it won't make any difference. And I think the indications, please remember something. We've gotten indications for the IPO for the US one from money managers all over the world. You'd be amazed at how many money managers who manage money, their family has these diseases and they want us to succeed.
Yeah, I think you also mentioned what's very compelling, that your valuation vis-a-vis some of these other drug discovery companies is so much lower than the ones you mentioned. So that's compelling.
That's one of the reasons for doing the marketing companies. What is Zhittya worth? We got 140 million. We have staggering data. What's it worth? Very tough question. There's nobody who has any doubts that the marketing company, as an example for Latin America, could probably do 30 billion in revenues on the heart drug alone. And their share is only 25%, but that's $7.5 billion. You take out the taxes, you're down to 5 billion. That's around what, $400 a share? And I promise you this, Alan, if they're earning $400 a share after taxes and the stock's still selling for 10, you want to buy some.
Fantastic. Well, those are my questions. I'm going to turn it over to Sarah now to take questions that came in from the chat room at this point.
Thank you, Alan. And thank you, Jack and Dan, for the great presentation. So, Dan, you did cover one of the questions here. There's a couple of other questions that you can probably take. One of them is regarding the parent company. What about the funding for the parent company itself?
Well, as I said, we've done 140 million. And I believe that by the time the marketing companies go public, and there's a total of 10 of them for different areas of the world, and the same securities firm has agreed to do all of them, and the same securities firm thinks they're going to go up materially. At that point in time, Zhittya will probably look at ways to raise it. So let me make a comment. To fund a phase 3 Alzheimer's trial, and we're going to start an Alzheimer's trial probably in Mexico so we can get early data on what's happening. But if we actually come back to the United States and do a phase 3, it's probably going to cost us $100 million. Well, I don't want to raise $100 million with a market cap of $30 million. That's what the pharmaceutical companies do now because they're looking to get their salaries. And by the way, Jack and I haven't been paid in 14 years, Jack. We're investing our money. I've put in 26 million so far. So the answer is that we have ways to raise the money like a clinical development partnership. We did one of these for the diabetic foot ulcer. We raised $5 million by basically saying, you pay for the clinical trials and we will give you a 10% royalty until you get 25 times on your money back. And if for any reason it doesn't get approved, then we'll give you 3% of our revenues until you get your money back plus 1 time. So there's a lot of very unique ways. And please understand, we have investors that are billionaires. We have limited what we've allowed them to invest in a marketing company. The first marketing company, the United States one, the maximum anybody was allowed to invest was 50,000. We have some amazingly influential and powerful people who were angry with me because they could not get more. They understand what this could mean. But the point is, we're trying to spread it because you need so many people to be on the New York Stock Exchange. You need so many people to spread the word. And we have, if you read our list of shareholders for the Middle East, North Africa, it's the who's who of not only medicine, but politics. In Latin America, we have some very impressive investors already, and we're getting more. So we try to spread this out because while everybody on this TV is concerned about their health, to people in Singapore, the center of the world, Singapore, to people in Dubai, the center of the world's Dubai, but they all have the same health conditions. And they all want us to succeed because we can save their lives or the lives of those they love.
Thank you, Dan. So there's a couple of other questions as well. Maybe you can answer them. I'll just mention a couple of them here. So have you done something similar to what you're doing now in terms of pre-IPO placements for the first 3 companies? And
Yes,
okay, and then also if you can just briefly touch on the use of proceeds for this round.
Well, once again, we did a pre-IPO placement for the US company, and most of the money has gone to lawyers and auditors from the pre-IPO placement. The same for Europe, all these companies, because they have cost. But once they go public, the use of proceeds, let's call it $10 million net, because there's an over-allotment option, et cetera, et cetera. $10 million net, the companies have budgeted $2 million to spread the word, to let the world know what we have. So everybody on this broadcast knows somebody who's suffering from the diseases we can affect. But if a person has no option heart disease and they know that we have a way to save their lives, they're going to be a supporter of ours. They want us to succeed. We got to let them know we're here. One of the rules of advertising, marketing, is the people you seek are seeking you, but they don't know where to find you. We have an investor in Abu Dhabi. He is a doctor. His client is one of the most powerful men in the Middle East, sits on one of the largest sovereign wealth funds in the world. He had a stroke last year. So there are people, our goal is to try and spread the word, spread the attention. So yes, we're doing a pre-IPO, we're taking them public with the same securities firm, and I hope they're going to fly. And they would just keep pulling the train along.
Thank you, Dan. And then lastly, why did you choose to put every company under the I'm not sure if this is why not, or why put every company under the umbrella of U.S. operations?
Well, actually, they're not under the umbrella. They're all standalone businesses because I believe in chaos and competition. So Jack gave a perfect example. We designed the trial for Parkinson's disease, and Jack worked with experts, and we paid money, and they designed this Parkinson's disease. We put the protocol together, we filed it with the FDA, and blah, blah, blah. And then the FDA wants us to do another animal trial. So we found out, people told us maybe Mexico. Who knew Mexico could do clinical trials on Parkinson's? We went down, we saw the hospital, first class, but the doctors there said, well, do this. What about this? No, you should add a spinal tap. What about this? Oh, we can image the brain with our scanners. We could do this and that. Wow, lots of unique things. So fine, let's try it. Let's get the individual genius, the entrepreneurship working for us. We went to Estonia. They had all kinds of ideas. We have an application on file there. We've been approached by a group out of Morocco that said, hey, we can do things and blah, blah, blah. So one of the things I believe in is you don't have one big bureaucratic ship. Alan was kind enough to ask Jack about Big Pharma. Well, during the financial crisis, we met with Big Pharma. I will not give you what I think of them because there may be ladies on this. They are idiots, they are slow, they are bureaucratic, and they don't care about the patient. Jack and I are impassioned to take care of these people. That lady you saw on the ABC news clip, Constance Donnelly, I was there. I'm a hands-on control freak, you can tell that. I was there. I met with her before she went in to be treated. I know that if it had not been for our drug, she would have died within a year. The doctors gave her less than a year to live. We extended her life by our treatment. I know that. We're impassioned. We're not sitting back collecting our salaries while shareholders are throwing money at us. We are going out and we're going to make things happen. And that means we need more friends, we need more allies. So we're going around the world and saying, hey, we're Coca-Cola, you be Coca-Cola bottling in Mexico, you be Coca-Cola bottling in Europe, you be Coca-Cola, and you make it happen. Not just happen with the medicine, but the drugs and the invention and the creativity. I'm a fanatic believer, bureaucracy is a death knell.
Okay, so we have another question here that says, this is kind of expanding on what you just spoke about, Dan. Are you saying that by having separate marketing companies for each market, it creates competition? And will the value of each marketing company be decreased by not putting them all under the parent company?
I think just the opposite. So let me do this. If a patient in Europe decides to go to Morocco to be treated for Parkinson's, the agreement between the marketing companies is they split the revenues. Right. If it's approved for ALS in Mexico and somebody from Chicago goes to Mexico to be treated for ALS, they split the revenues. If guys in Taiwan come up with an idea of how we can do the heart treatment better or treat a stroke patient better, everybody finds out about it. I have seen the big drug companies, and so you also understand, in the 1980s, I went into the former, or 1990s, I went into the former communist world to help the communist nations convert to free market economics. And let me tell you something, I would rather deal with a communist bureaucrat than a pharmaceutical executive. They are not aggressive, they are not hungry, they don't give up. So we want people who care. We've got a guy who's one of our investors in Germany. His wife has Parkinson's. He calls me every day and says, do something, she's suffering. Now that's the kind of passion we want. We want the people. Quick question, people in the audience. What country has the highest cases of deaths from heart disease? It's the Philippines. Who has the worst heart disease in the world? Anybody from India? Indians have the world's worst heart disease. These are all things you learn, and the people locally know this, and the people locally can develop the opportunities. I believe that we've got 10 horses pulling the wagon. And I like that a lot better than everybody being on one big elephant.
Makes perfect sense. Thank you so much for answering those questions, Dan. So I'll go ahead and pass it over to Alan for now so that we can wrap. Because
Thank you so much, Sarah, and thank you, Jack and Dan. We're going actually on 1 hour just now. It's 12 o'clock. So I want to thank the two of you for having such a illuminating discussion on all these different diseases. It sounds like you've got some fantastic opportunities to cure these diseases and have made tremendous progress with the capital that you've raised to date and your plans for these ongoing offerings. And welcome the opportunity to follow up with you guys and with the investors who heard the call today. I think as Sarah mentioned it on the call when we started, be a follow-up letter that'll go out either later today or tomorrow with a replay of this video. So you'll have a chance to watch it again, and there'll also be some contact information with the company if you'd like to participate in their offering. If you're accredited, you can click on the box there, and then I guess Dan will be in touch with you to follow up on your interest in their private placement offering. So again, we thank Zhittya Genesis Medicine for today's webinar, and I thank our participants for coming on this call. Thank you so much again.
Thank you, Alan.
Thank you. Thank you, Alan.